but we know how fragmented the industry is. And in order for the healthcare industry to move towards value-based care, there's a need for us to be able to capture as much data as possible. And if the providers aren't using technology to capture data, there's no way for us to understand the trends in this industry, which would lead to making better decisions, which leads obviously and ultimately to better patient outcomes. So I think, when you saw the ACA, Affordable Care Act, incentivizing or passed it was a different name, I forget the name of it, but it was under the Obama administration where they incentivized physicians to move to an electronic health record system so that they could capture data and make better decisions off of the data that they're collecting. I think there needs to be a trend in this industry, similarly, where a lot of these taxi companies and service providers are subsidized or incentivized to use technology so that we could capture data. We're tech companies, right? A lot of our decisions, it's data driven. And so for us to make better decisions and improve our product lines, and for health plans and health organizations to make better decisions, we need to be able to collect data. And right now, about 25–30% of the industry is using some type of technology, and the rest aren't.
Yeah, I agree with you on that. Of course, was it called meaningful use? Is that what it was called?
Yeah, meaningful use. It's when, I mean, you're coming from the industry as well. You're coming more from the ambulance side of things, right?
Yeah, so we're, as we like to say, full spectrum, and I think probably same space as you. So ride share all the way through medical sedan and taxi, wheelchair, stretcher, and non-emergency ambulance. So the full spectrum of ground transportation services are available through the marketplace model that we create.
Mm-hmm. Mm-hmm. Right. So, I mean, I'm sure I know are your direct customers providers? Not necessarily, right?
Yeah, so when we say the phrase provider, we mean healthcare providers, meaning hospitals, health systems. So those are the folks that would be using the technology to access the rides that are needed for the populations that are served. That might be a care coordination team or a care coordination organization. It could be a care management team at a Medicare Advantage plan. Those would be the folks that are the eyes, the ears for the patients, the navigators for those patients in transport.
Right. So, our service providers, the market that we're obviously catering to, it's the actual taxi companies, the taxi providers, the brokers. I think that's the middle ground. We have health plans, brokers, right? That's that middle space. And beyond that, our focus market initially was taxi companies and operators that transported patients. And I think for us, your company, where it's on the logistics side of things, supply, demand, ensuring that the demand is met by your network of suppliers. Us, I think we come in afterwards, where once the suppliers fulfill that demand, there's a need to now get paid for it, right, to continue to operate. And that's where we come in, right? So our two companies are in the middle of logistics and payments. And so for us, being on that side of things, what we've built out is technology that's able to take data from systems like yours, right, and automatically generate claims and invoices and bill the respective parties. However, for us, it's very hard to do that when, vast majority of the market's not digitized, And I think you could also share your experience in seeing that, coming from the EMT world, that's been consolidated to some degree, whereas the NEMT world, it's still not been consolidated. Would you say that?
Yeah, I would agree. I would agree with everything that you're saying. And I would certainly say that it is largely still manual.
On the EMT side?
Yeah. So like you said, the availability of data is not very rich.
Right.
There is still very much a telephone-based, and is such the case in healthcare, fax in some cases, models for accessing, ordering, in many cases delivering patient transportation. So where we see a great opportunity, just like you said, is the same thing. If we can combine access and insight with payment and claims rev cycle, we're essentially connecting all the dots together to say, you can use technology, you can order rides for a population, right ride for the right person at the right time, that ride is delivered, that patient's trip is billed to the appropriate payer, that transportation company gets paid, all of the data is aggregated to finally tell the story of the impact of transportation to health outcomes.
Exactly.
So what we frequently see is that everybody knows transportation is a problem.
Right.
And it's riddled with complaints. So patients are complaining generally from lack of engagement, right? There isn't transparency into transportation, into the ride sequence, into the ordering, into the timeliness, because it is largely manual.
Right.
And so by introducing, I can't believe I'm saying like introducing a level of technology that allows for that ordering to occur, right? And then connecting all of those dots all the way down to claims adjudication and timely payment to those transportation providers would cut out a lot of the waste, a lot of the manual processes, right? And we've got the insight to now engage the patient, the care manager, the plan, the transportation provider, all of the parties to say this is the value that the ride has offered. Right.
Right.
I think that's really exciting.
Yeah, and to your point, it's just that fraud, waste, and abuse side of things, right? So fraud is one thing, but then let's say waste and abuse, right? Waste on the administrative side, it's tremendous, right? I think if you look at the overall healthcare industry, $3.5 trillion industry, where almost more than $500 million, it's they put it under the bracket of fraud, waste, and abuse, and a lot of that has to do with technology, right? Inability to track what happens let's say I'm a payer, right? That's where the demand starts. Or let's say I'm a patient, that's where the demand starts, right? Now, what happens is, if a health plan orders a ride and the transportation provider gets it, they don't know what's going on with that ride anymore because there's a technological gap there. There's no transparency between the health plan and the TPs and the operations beyond that. And I think with interoperable technologies, health plans, brokers, and all these different stakeholders, whether it be Medicaid, Medicare, etc., they get full transparency on the entire life cycle of a ride, which helps adjudicate it, right? It, Obviously, we spoke about this a couple of weeks ago. Like, how is it possible, and how has it been normalized that I provide a service and I have to wait 60 days or 90 days to get paid? No other industry would allow something like this. But in healthcare, it's been normalized and accepted. So if I want to, provide a healthcare service, I go in knowing that that's just how it is. And I think with technology, it's about time, companies like ours start challenging the status quo. And it's really trying to say, hey, this should not be the norm. People shouldn't wait 90 days to get paid. How is it possible for a company, a small taxi company, who owes their driver, money, a paycheck every 7 or 14 days, but they get paid every 60 to 90 days? They have to bridge that gap through invoice financing and factoring and all these creative ways to just make ends meet. And then a recession hits, they're gone. And that's a big challenge. I mean, look, this problem we're solving, yeah, in major metropolises, it's fine. Transportation is available, bus, trains, all that stuff. But in rural areas where this is a real problem, a local taxi company cannot go out of business because of the impact it's going to have on the healthcare outcomes of patients in that area. And so that's why, again, going back to subsidizing technology for people who are already on thin margins, and the fact that they don't get paid frequently enough. And it's become an accepted norm. And, I think with technology, we could definitely improve that. Definitely improve that. I mean, what are your thoughts as you were coming up, or with your company and you're building it up? Did you face that as well when you were trying to partner with folks? There's just resistance on that side, which leads to lack of interoperability. People don't want their technologies to talk to each other because they want to go after the same market and things like that. So do you see that as a problem where there's a need for more companies to be open in terms of working together? Do you see that?
We've seen a couple of things. We've seen first, they just don't have that data or insight. So I thought that was pretty eye-opening, that organizations truly do want to get the best data possible, but the industry is moving so fast that even the legacy systems just don't have that insight. Information down to the driver level or the transportation company level just doesn't exist. That it is still manually phone-based, or when even asking a healthcare provider, how many rides do you order for your institution, for your organization? They have no clue,
Yeah.
no idea.
It's so funny that 3.6 million rides data. It's been over a decade that's been used, and that's because nobody has anything else to really reference to, right? Nobody has anything to look at and be like, okay, this number is substantiated. I think that number came from research years ago, and that's still being used. Whereas, the number of Medicaid recipients probably, doubled over that period of time. There's no way it's 3.6. It's much larger than that. And we know that because we're in the industry and we have insight into it. How many trips are being canceled, how many patients aren't showing up, how many drivers aren't showing. We have insight. So we know that it's far more than 3.6 million that's out there and everybody's using it. That just goes to show that there's lack of interoperability, lack of data to make decisions. All of it leads to just us using data from 10, 20 years ago to make decisions, which is not good at all.
One of our clients, when we started with them, the hospital system, we asked them how many rides they order, and it was
Mark cut off.
Yeah, I think we lost him on a cliffhanger too.
Let's see if he gets back.
I wasn't sure at first if it was me or him because you were so frozen and you were so like still in how you were pondering thought. I can tell.
That's funny. How's the call going so far? Good.
It's great. Yeah. No, you're so natural at your ability to just like actually have a conversation rather than needing to rely on
yeah
structure. So yeah, you're a great guest. Appreciate it.
Let's see. Let's see if Mark joins again.
What do you got going on this weekend?
Just catching up. I had just the worst parts are like when you have a week full of meetings, then you got to catch up on all these meetings and all that stuff.
Well, sorry about that.
Oh, good, Mark. Welcome back.
Thanks. Thank you. I was just saying that one of our what's that?
You had one instance or one customer.
Yeah, we had a customer that when we started with them, we asked them, how many rides are you ordering a month for your patient population? They actually had a log. And when I mean a log, I mean an actual notebook where they essentially scanned it and emailed to us this list of who had a ride, when was it ordered, who ordered it, where was the patient going, and that was how they were tracking patient transportation. We're talking about like 2018, so we are not talking a long time ago. So it was pretty cool to see us dislodge the notebook model, but they were not alone. We have plenty of clients that really had no tracking or had no clue, and thus had no way. If you don't have the data, you can't manage it, right? So they were trying to get the data to say how many rides, who, where, when. But all they knew was that transportation was a problem. Patients weren't making it to or from their health system. They were missing medical appointments. They were getting sicker. And they also knew that transportation was impacting their ability in timely transfer of patients from one healthcare setting to another. And I agree with what you said, the 3.6 million stat. Everybody knows transportation is a problem, but they just don't know how big of a problem it is or where to begin with it. They just have that macro statistic that was probably just triangulated and is fairly out of date at this point. And so what we're starting to say is by connecting all these systems together, from the electronic medical record system to the transportation CAD software that exists, or the routing software that a transportation company uses to move their fleet, and other systems, we're able to show end-to-end transparency, I think is the word,